All right. So, congratulations, first of all, to the candidates. And we are going to start a live class. And before that, maybe, we can invite maybe a doctor at least can share a little bit before we start. Actually, can be a little motivating. I think some of you already know her because she was in that batch, but she was revising at the same time. Of course, she was preparing and also helping with some of the doctors and some of the also class monitors on my request, actually. So I think you can invite Dr. Jomers or Joshna. I think if you are online. Great. Okay, so she'll be here in a moment. Congratulations, of course, to many doctors who, yeah. Okay, sure. You can, come in 2 minutes. Uh, Great. Yes. So we'll start our psychiatry session 03 shortly. And before that, we'll hear a little bit from Dr. Joshna, Dr. Jomets is her Facebook name. Yeah, so starting with the code, it always seems impossible unless it's done, right? So for AMC, I think it always looks like this before it is done. I mean, we'll hear from them actually, no worries on that one. And of course, personally, if you ask me, of course, I'm feeling very happy, but I think they are feeling more happy. And this is something to be proud of, that this exam passing is a challenge itself. And against many odds, some has, kids, some has, pressure, job. In spite all of them, passing this exam is really creditable, to be honest, actually. Not a so easy exam to clear, actually, but we do have good result. Few of the things, factors, I mean, dedicated, classes, and of course candidates participation and being very regular in 5 months. And some doctor also later join special recall batch if it is needed. No one also take a risk with MC exam sometime with, because exam fees is high, so people want a sure shot often. And then, of course, a complete good revision. Very, very important. A good revision actually at the end. It's not about just finishing course. You also need to revise those things. Good thing nowadays, we have that our own AMC notes. So before exam, it's more precise because a lot of notes you have seen are quite a coincide actually, because we are also teaching from John Mutta at the same time, this coincide notes. So coincide notes, the benefit of this thing is, you can revise very fast, especially at the end, right? So it's not a very, long PowerPoint slides normally. So coincide notes are good. Then our special before exam videos are good. You can, should must watch them. And also revise, recalls, especially latest one in last, especially 15 days, you should try to revise the last 6 months. But overall it's like a 2 years recall, highly recommended for all of you to revise at the same time. um, See, in spite, it is good that many doctor passed, good results are coming. And also as a sleep, one two doctor also get fail. It is also true that not when in 1 month you have a 50 doctor passing, not surely 100% pass came. So 2 3 doctor also slipped out. It happens, I mean, most of the months. Less happens in, I mean, some particular months, but that's okay. But when we asked them and take some interview or things like that, and we figured out some of the same common problem, actually. One of the, it's very obvious, lack of preparation, lack of engagement. And then people say that, okay, I'll be try to be more regular from now on. But see, I wish, previously he or she could have told that one, that I would be. And very, very importantly, when I ask a common question, do you have a study partner? And answer came surprisingly no. So still those of you are not having study partner, it is a red flag in AMC, right? So already, few damage are done. Already some damage are done. You can understand that. Yeah. So that is if you're not having a study partner, still you have time. You can cover up by having a study partner, study groups, um, engage everywhere, like, participate in guideline group, because don't miss important trending questions. So participate in large groups. And if you have WhatsApp group, some people too much prioritize WhatsApp group. Like, see, we also used to be at a time preparing for AMC. We also used to have WhatsApp group, Messenger group, own group, but we regularly use the main stem forum too, actually, in spite of having. So it was like a double preparation. So those of you think only doing that WhatsApp chatting with friend or group of friend is always helpful, this is one part. But that main stem groups are also very, very important, and try to be answer with more details. That also helps. It's actually not others are getting help, it's you helping yourself. If you answer not like answer A or B, but if you just can answer as a, okay, it is A because I think, you know this, say any condition, okay, in rheumatic fever, probably, this test is confirmatory, I think, because this is the reason actually, or this is the diagnosis, maybe pulmonary embolism because there is a long flight history, and I can see the lab changes. So if you can have that habit of writing in that way, it will be more nice in that case for um, all of you. I mean, to practice in that way, because you have to rethink. If when you have to write something, you have to rethink. Yes, and you will think the am I right or not, like, so that will give you more chances of being more correct actually. So please make sure you practice in that way. It is very, very important, I'm telling you again and again, all my dear doctors. So uh let's just see, hear from one two doctors. Dr. Yeah, Joshna, if you are here.
Hi, doctor. I'm here. I'm here.
Yes, how are you feeling today? Yeah, congratulations actually.
Thank
Yes.
you. Thank you,
Yeah, so it
sir.
was a little late. I didn't make a call that time. It was a little late for me, but I congratulate you. All right, we'll talk, no problem, actually. And yes, I think you also shared a little experience already in our group. So thank you for that. Yeah, so probably a long journey for you in AMC, but
Yes.
inspiring, and you have been very supportive to all the members, and I think very good class monitor at the same time actually. So few words is your victory speech. You can take 5 minutes and tell them something actually, how you're feeling, and maybe a little bit thing from preparation actually. Already, even though you shared your experience in guideline group, maybe we like to hear a little bit from you in that case. Yeah.
Definitely, sir. So first of all, I'm very happy because it's as I said, it's been a long, very long journey, and I've been looking forward for this from quite some time. And with what do you call, with God's grace and all the hard work and your guidance has definitely made it. So to start all of this, I had initially, to tell the truth, I had a very proper planning, and not only planning, sticking to it was the most important criteria. What I have understood, like even if I've got the marks and everything, I think that when you have a schedule, you have planned it out. Make sure your plans are written down, and so every day you can look at it and see, okay, this is what I have, this is what I'm going to follow for the next few months. And it's very high likely there is what do you call, chance of getting depressed because, or losing track, because it's not like 1 or 2 months of hard work. It's almost like a long way, maybe even a 1 year. For me, I took almost 1 year. So I started planning was in August 2021. So then what I did is, through a friend of mine, I heard about your classes, and the first thing I wanted to know was that, like, it's not about you, but whether I am able to follow and understand, because for me it was not like very big complicated words, or I liked it something that is very simple, apt, and easy to follow. So I went into your YouTube channel, and I personally went and heard a couple of your class lectures. I was like, okay, the GIT, especially the GIT class and one recall class, I went and I followed there. And that's when I decided that, oh, it's easy for me to follow something that I can absorb and
Hmm.
I can follow. So that's where I decided. then I had to resign my job because I didn't want, what do you call, I wanted to give my 100% rather than, I knew that because with the child, and I tried before with a child, then with the job to study, but it was not happening. I used to fall, even though like for a few months I was able to be on track, but due to some reason or the other, I was falling off track. So that's when I decided that I, what do you say, I resigned. I have, only thing was that I had a son, so I was having an issue of managing. So I told my husband, I'm taking a 1 year break from there, from Australia itself. I flew down to my parents, and so that they can also help me out in looking after. So even though when in the class, when people used to say that I am very cheerful, I'm very supportive, trust me, even I had my ups and downs. But I was like,
No, no, it's true.
I didn't channel it, or I didn't give a chance of doubt. Rather, even though there were days when I was so confused, I didn't know what to do. I just went for a walk. I remember sir saying, just go get a walk, you do that, listen to your music. I channeled in such a way that the negativity will not affect me. But that, as I said, that doesn't mean I was not negative or I was not confused. But it's a way of how you train your mind. That's the most important. And very, 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 very important is that when you make a plan and stay focused, always make sure. I remember always sir said, have a table, make sure you sit on a table which is properly adjusted. You have all the books next to you, have a clean table, have a wall. So I still have my walls. I've not taken it out. I still have a wall of saying how I'm planning with sir's what do you call, timetable. Then which all topics are we finishing? What all I need to do? And I used to tick and go as I go, so that I know that where I am and what all I need to get it done. So for me, because I had a long gap, for me, I my plan of action, what I thought was suiting me was that first and foremost, I was adamant that I want to do the theory properly. So I stuck to sir's 5 months class, and mind you, all of you guys, I have not missed even one single class. I made sure that I attended. That was the most important. And to tell you the truth, that makes a huge difference. And going back to the record, I personally in the initial days used to go back to the recording, but I understood that being in the live class in 3 hours you get things done, but when you go back to a recording, there's high likely chances that you want to take a break after a 1 hour, and then you'll see that the 3 hours class end up to be a 6 hour class. So towards the end I mastered that. So I used to make sure that only live classes, I never used to go back to recording unless and until I think that I need it. And even though sir used to teach in the class, I had my JM opened, as well as I had a pen and a paper, and I used to write the notes, what he used to say. And in the week, in that following week before the next class, I used to refer the notes I have and the JM of the same topic, and made a final one note, which I knew that for the end, that is what, or for lifelong. Like I have the set where that those are the main topics, and what do you say, the explanations were, so that even for clinicals or any other thing exams in Australia, I just need to go and refer back that notes rather than going detailed into the JM and reading again and everything. So most of my study mates, when we were studying, most of them were pretty surprised that they didn't make notes, but they just wrote in the what do you call, JM. But trust me, when during the last 1 month or during your revision, it's not easy to carry around your JM and do revision when you're doing recalls. So always make sure towards the end, that especially the last 2 months or 3 months, I joined the recall class, but along with that, all the theory notes I had, I made sure I comprised or concised them in one single page. Like GIT system, all the topics, I made it into one page, so that it's like just the bullet points. Because when you start solving the questions, you realize that you know the topic, but how will you relate your topic or your knowledge, what you have in the theory, to the exam questions? Because you have a specific time in the exam, you need to catch the main clue points when you see. So that's like the age, the what is the vitals, or what are the symptoms. So as soon as, so for me, when I saw the questions, you get an automatically differential diagnosis, you get the idea. So that's how you manage your time. So for that, you need to know how your theory, what you have studied, how you will do in in practice for your exams, for exam. So for that, all your theory has to be one point concise note, so that when you revise again and again, for example, peptic ulcer, you know this is the main points, no need to learn the whole different thing. So that is where what do you call, we had I was practicing. Then I had a study partner, but it was only towards the recall class that I had. Other than that, we had a group of 5 people. We were not like study partners, but we were there for each other anytime. So in 24 hours, 7 days a week, at any odd time, because we were all in different time zones. For any doubts, we used to leave a voice message, so that this is what I have, can you please explain soon? So that person used to just quickly explain, and vice versa. We used to do that. And towards the end of the 1 month before the exam.
Sorry for cutting down. Your other partners also passed, I think, like Anusri and some of the others also.
Yes,
They also cleared, I
yes,
guess.
yes.
Okay, good.
Actually, we were 5 people.
Okay.
All 5 of us have passed, actually, to say.
Yeah. So it's a double, like happening. I also got a message from Anusri as well. So I think, it's a blast. Like, so, these few things, like, see, very dedicated, group of 5, that's something I was, telling all the time to the batches actually, and stick together, anything that came up important here, there, whatever you're saying, helping each other, so very, very important, study partner or partners,
Yeah.
because, see, if 5 people, like 5 brains are working. If like 2 people, sometimes what happens that, you know, it happens, everyone has problems. So one day if your partner is saying, okay, I'm not feeling well, okay, my kid is sick today, your study process is totally gone then. But if it is a 5 people, and if you make a schedule, like others cannot tell in that way actually, and you should also make promises in that way, like whatever we plan and schedule, if just one person back out, will not gonna stop actually, then the other person will manage somehow. Okay, so that's just a tip from my side actually. Okay, doctor, you can continue. Sorry for cutting down.
No,
Yeah.
no, that's fine. So in terms of that study partners, so we 5 of us, we were not like sticking every day because it was because of our issues. But when we used to tag each other. These 5 of us were the ones that we were tagging each other in the AMC guideline group, like under questions. We used to tag each other, so that I used to solve and I used to tag 5 people of these 5 students, say, what do you think about this? So they used to give their opinions, and then we used to come to a conclusion based on one. So we used to find references. That's the most important. So when you do a guideline group question, it's an incomplete stem, but the goal for that is that rather than fighting over what's the right answer, try to look into what is that topic and try to read somewhere, like all that references group like RACGP, Medscape, MedBullets and all that. They actually, if you spend time, it's not much time consuming, but if you spend time and see, there are clear things mentioned under it. But it's just like we are so lazy to not go take the initiative to go and read. You have to read, you have to do your own researches also. Then you will understand that, okay, if someone says this is not how it is because this is what it is, you give the reference like that. So that was how we used to do it. And if at all one of us had a doubt, we used to send by messenger. And then after solving, we used to send that answer to all the other people also, that they can also, go through it. And it was voice message on specific topics like, the main issue we had was the fluid maintenance calculation. So that we found somewhere, then I wrote down and I took a like a printout, and I passed on to all the 5 people. Last month, 1 month before the exam, what I did was that I had one dedicated, study partner. In fact, she and me had the same center also. What we did in that 1 month was we used to revise the theory on our own, but every day, or at least every other day, or if at all, because if I had a son, so I might not be dedicated like every day, but still we made a point, 2 to 3 days a week, 2 hours to 3 hours, we used to both sit on Zoom and solve past question papers, which sir had provided towards the end in the recall classes. So 2022, we made sure we finished everything. Then because we were giving the exams in November, the last previous, like from 2019, 20, 21, 22, all the November questions, we made sure we had gone through, discussed, and as we're discussing, quickly we say even the theory, what we knew. So even though we are solving it, we're just saying, okay, this is the main exam. And we used to question each other. Do you know what is this? Okay, then can you tell, okay, what is it? And we used to repeat, we used to shoot questions to each other. So that was helpful. Even she said that was very helpful during the exam, because there's so many things. I used to saying, she had told me, if this question comes, this is what it means. So that was a very good, resource for me. So in short, what I'm trying to say is that even though it was a 1 year of planning, you can imagine towards towards the end of this year. I had made a goal that I want to pass. So by before the next new year, it's new targets, everything. So sticking to it, in spite of the, as I said, there's going to be a lot of distractions. Minded, there's going to be a lot. There'll be something. You fall sick, someone else falls sick, or something else came up. Parents will have, or workplace issues, everything. But my first thing is, if you're planning to sit for AMC, make sure that if you have the option of able to take a break from studies or no family or anything, you totally need, at least in the beginning, or if you have an issue with theory or anything, 8 to 9 hours of studying every day is mandatory. So for me, I used to keep just the Saturday free. So Saturday, I made a point that I would spend my time with my family. So this is what, that was like a mandatory rule, because as I said, I had a son, and I used to go crazy just going every 7 days to study. So Saturdays for me, because that's the day when sir doesn't have class also, so I made sure that I would not, study that day. As I said, initially 8 and 9 hours, but towards the end, 5 days. It's like, because you will not know how the 5 hours goes, or honestly to say. And so it's not like every day you have to do the same thing. So I used to opt 2 days in a week for the blue book, which is mandatory. I think I did almost like at least 3 to 4 times I did that. And I got like almost 4 or 5 questions out of it. Other days I used to do is theory notes, some as a revision. Then some other days it will be like if I don't feel like doing anything at all, go to the sir's guideline group, and you know how they have the radiology, all the radiology. I think I went at least 2 times over it, all the pictures. So it was like, as if even if in the night you ask me, you call and ask me, I will tell you in my sleep also, because it's like it gets familiarized. You just keep watching, keep watching, keep watching. Those minute things, when you don't feel like doing anything or nothing, just go to that and keep looking. Or if you don't feel anything, ask if you have a study mate, that can you just quickly tell me something, even if you're not like want to read, at least you can hear from something. And if nothing is possible, so what I did is that I used to record, like, how all of your phones, you have a recorder, so you have a record. So I used to read out my theory notes, and when I don't feel like reading, but when I go outside for a walk, I keep a earphone and I keep it on repeat, so that at least 10 times you hear, that even unknowingly also it just gets stuck into your brain, those things. You'll see how in the exam that things are coming in. Once you finish everything and revising, you will definitely find that you are not able to recollect anything. You feel totally lost. What all you studied, you think it's lost, but trust me, it's there in your brain, and it will come out when you give the exam. And as I said in my previous class also, there is, in the AMC website, you have the AMC trial MCQ, and that is based on the blue book. So I started doing that as towards the end. Sir will give you 3 tests for the handbook. Make sure you stick to it. Do the preparation. When sir is saying do it, because I'm telling you, I went through everything what he said. I was sticking to it, and I made sure I finished and go along with it. Even if it takes a little more time or you slow, take take a less 1 hour of sleep and finish it off. You will see at the end, as I said, today when I stand and see and look back of how much hard work that has paid off, it's a totally different experience. So stick to it. And once you finish that blue book exam, every once a week, go to the AMC website and do the trial question. That trial question is exactly of that blue book. And you will see the first 2 questions in the trial MCQ is the exact same trial questions they give you for the main final exam. So as I said, this is my 4th attempt. So all the 4 times I remember that the first 2 questions they'll give you, this is how the trial is, these are the way the questions is. That's exactly the same as the trial one. So the blue book, at least you get an opportunity to revise the trial questions to the blue book by going to the trial MCQ and doing it. And what all you make mistake, they'll tell you which answers were wrong and which MCQ in the blue book it is. So I used to go back into the book, and I used to write down, okay, this was a question. I used to make a note. So that is something that I'm still making a mistake. So I used to go back and do the recalls, So in short, what I wanted to say is that, first and foremost, you plan it. Secondly, make sure you stick to the plan. Have a very good what do you say, have a very good proper disciplined, like a proper table, chair, not lying on the bed or anything, because I had a laptop which was stuck to it the first thing I came. And when I, before even sir's course was starting, I had the laptop, I had a table, I got a printer if I had to print something, books on one side, all notes, sticky notes with different colors, what you want to do. So you need to have a visual, what you called, a representation of what you're going to do for the next 9 months. With that, when you do that effort, along with that, sir will give you, like for example, which topics you're studying, everything that the sir is giving you as a timetable. Stick that and follow it, so that you have an idea what's going to come, where I'm going to, what I need to revise, or what I'm going, what I need to do, which is my what do you got, things that I'm weak in. And main thing I want to say is, do that day's work that day itself. Don't leave it for tomorrow. That's the most important thing. Once sir finishes the theory, make sure in the next 24 hours or 48 hours before the recall, that you make the notes or whatever you want to, however you are comfortable. So for me, it was like I wanted to compile, because I cannot, when I say JM, it usually freaks me out during the last minute. So make sure that what do you called, make your notes, and stick to it, so that by the next class, the good thing is when you do the recalls on that day morning or before that or previous night, go through quickly, so that when you do the recalls, it will be helpful. Because if your theory is not strong, there's no point doing the theory. So you can see in the week, it's every day is a dedication, except for you can take one day, and that's for 9 months or 8 months or 3 months, depending on how your goal is. So that is the most important thing. So for me, it was like a childbirth only. So 9 months after pregnancy, I delivered. So same thing. I started in Feb 2022, and in November, I got my results, and I did 5 months of theory. As soon as I finished, I did the 3 months of recalls and the recall course with Sir. Then 1 month of preparation of collecting everything together. And then I used to follow what Sir said, because I was going out of the country to give my exam center was in a different place. So I followed what Sir said basically, and what all he used to
Mhm.
give, and just stick to it, and it makes a huge difference. So I hope everyone is encouraged by what I've said, and hopefully
Yeah.
I want to see all
Yeah,
of
I
you
think
guys on the other side.
yeah, so I think it's a very details experience share, I think, because this batch is also preparing now and almost at the end. I think they can correlate certain things. I think it's very details. I think it will be motivating, and especially those are still not taking things seriously. I think that will be a eye opener, because for me, now thing has become, it's like a, um, the very famous quote, "Ghar ka murgi dal ke barabar." It's kind of like that for me, because they listen to me almost every day. So I think now they have become little resistant in some cases. When I say, too many things, maybe they said, okay, he keeps saying things. So maybe if since it comes from some other persons, they will also reconsider and think, and probably uh, same thing again, that see, doctor like was free, and she was studying like 8 hours actually, especially in the last days. So and eventually hard work also paid off. So very, very important, you need to finish things nicely, revise things nicely. There is nothing like miracle in MC, trust me. It's not like a all other usual exams and the things. Actually, I think no exam does not have miracles actually, except for some interview or viva board. Sometimes it's different, but uh, when it's like it's been set in that way, that you will be tested in every aspect in the main exam hall actually. So there is no other way that you can get out just taking less preparation actually. Rather, sometimes rather accident can happen in spite taking proper preparation. Thing doesn't help actually. So both mental preparation, physical preparation, all are recommended. Like, it's a mind game as well actually. So you have to sit for like almost like 3.5 hours. That's also very, very important. Also, please don't forget to see our last 40 days um, preparation routine, which I made, I think, few days back actually. That's available in our video channel, not in our YouTube. Please have a look on that one. I think it would be also helpful for many actually. And um, I think the things now it's like worth it to share, Doctor, that how things well and you finished, and few advice for Dr. Joshna as well, that make sure you continue this study thing. So because I can tell a lot of things from the experience, but this is also true that many people after passing MC1, then they get relaxed for some time actually, and that also shouldn't happen. When you started the journey, make sure you finish or end it. Actually, there is not like a time, okay, I'll finish MC1, let me take some break. And some people go to too long break. Okay, so see, in MC2, and to be honest, in another thing, that it's moreover like uh, quite similarity in many academies, to be honest. Like I won't put myself too ahead of any other. So if like the better to join someone whom you trust, or maybe you can make best out of it. It is kind of like that. Okay, so that's the thing. MC1, I think I still believe it's like huge difference, like any other academies things, how much effort we put makes us better actually. It reflects on the results every time, and also number of candidates confidence and they're joining. People usually still don't much think about going anywhere actually, but you will find option in MC2, because as I mentioned, in MC2, I always speak the truth actually. In MC2, you will not find too much differences in between lot of courses and the thing. So it's more about like the where you are comfortable with actually. If you have very good budget, I would even recommend you can also join in Australia, like no problem on that one. Yeah, but make sure one thing, if anyone even in future join MC2 anywhere else, like say in Australia, especially like in center based few things actually, there are some bridging courses also available. So of course it's very expensive, no, but many people are well off to pay that fees. So you can also do that actually, but make sure you study well. So a big number of students also do that, like they usually do our online, and then some cases consider going to those big centers, because they usually finish things in just 1 month. So you can understand a whole thing finishing in 1 month. If you're not ready, it's difficult to absorb. Actually, we take some time. We take like 4 months to finish, including physical examination. So see, contents again quite similar. We do give more recording. We're more flexible in MC2 in terms of recording things, because I believe watching videos and again more helpful in MC2, because there are limited cases, not like in MC1. So, and of course, note that matters. Yes, I will put myself little ahead in terms of the notes in MC2 actually still, because those are also recently updated in 2021 and 22. I updated all the things, but in MC2, some of the other institutions probably still using the same old notes, or Marwan notes, Karen notes, those things actually. So we have updated those things. So this is one plus point probably only, I would say actually. Rest things, you'll find me in doing role play. That's something additional. That's okay. And in MC2, other than me, also some cases, one doctor maybe came up actually, to because difficult to manage otherwise, so many things actually. So that's all I think from us. I think so. Let us finish this experience session. Thank you to Dr. Joshna again, so for sharing. Any last word to them?
Well,
Any last word to class monitors? Any last word to class monitors? I feel I'm missing you a bit actually, because it's you know putting them into your level is a bit difficult actually. I was telling them they're not much regular on and off, so it's also responsibility, I think.
yes. So, in terms of class monitors, what I can tell you is that, see, when you're chosen as a, or you have opted yourself as a class monitor, make sure that I wouldn't say like a leader, very high leadership, because we're not competing for
Yeah,
some.
it required a leadership quality, I believe actually, because see, some people just, I felt like, came up with interest actually. They may not be even class monitor in their classes, but it's a priority even in next batch. If anyone previously being class monitor of your med school, you are a topper of your med school, please let me know, because some of the natural quality class toppers or class monitors, it's quite natural actually. Others, they all are good actually, but this little leadership quality, like we also always don't find like, good ones like you. I mean, I previously find Moon, very good. Then few came in between cohort, then some were really good actually, in terms of, class monitoring and the things managing. Yeah, so I think even Gohar was also helping, I think some of you, during November exam actually, she couldn't appear now because she has a small baby, but she soon will appear actually. So I think it's a team thing overall actually. A few things came from responsibility and leadership. Yes, and I think because you have been a bit mature, so you understand the word responsibility as well.
Yeah.
Yes, in this I think current batch, some of them are too young, I think, to realize that it's a responsible position sometime to manage and keep in
Yeah.
touch and update. Because you see, I still remember you also sometimes motivate, sir, this topic maybe if you can cover for us is good. So I increase one two topics as well later. So that's the thing, like it's like a voice, it's like a conveying also. It is also true, like not only the students get motivated from the teachers, teachers also get motivated from the students actually.
Yeah.
And of course, like from class monitors, it comes even more because they're the voice of the students and feel like maybe we need a topic and the thing I increase. Like example, if you remember, I added psychotherapy, right? If you remember
Yes. Yes.
last time, because it was unique, more questions were coming. So
Yeah.
I add a whole one on psychotherapy. It was very unique and different lecture actually, because I also need to study very details because I'm not psychiatrist. So
Yeah.
psychotherapy in that level only psychiatrists know actually, to be honest. So I had to, again go through all those things. And because new questions were coming, so it came from some of you that maybe we need that. So for that one, you need to also see the trending question for the class monitors. They can also update me. Even the batch is finishing, some of your job would be over as a class monitor, but I would say it's not finished. Like, if you realize something, you can also get back to me, and a relation more developed, like with, especially with you, say example, now, feel like, more like family, right?
Yes.
So that's also an opportunity to remain in touch and things like that, actually, because it's a huge community of student I deal. Not everyone uh, individually very difficult, but I try. But with class monitors, I'm very close always actually. So like to keep that one even in future, like because eventually all of you will be in Australia. So
Yeah.
it's more fun, when I go like invite sometimes, or we can meet any coffee shop, park, even in front of opera house or things like that. So it's fun. I need cherishing memories. You'll get to meet some people which you, I think now, how would you feel? Many people you are studying, you never seen them in your life, right?
Yeah.
So yeah, but one of them you meet, you said like, same exam center. So
Yes.
how that, you know, uh, experience came up that day, when you meet that person after a long time, that was interesting, must be, right?
Yes, yes. So the five of us, as I mentioned, we have a very special bond in that the two of us, like the three of us actually,
Mm,
I met one of them in India when I went for the exam. We had a lunch together even the next day. So it
yeah,
was really
see,
good
yeah.
sharing her experiences and everything. And she's also planning to migrate to Australia soon. So I gave her the heads up saying that before anything, finish off all your exams. I don't want you to follow what I went through. So she's also taking up. It's like, in short, it's like encouraging them, even though you have
Yeah.
your own issues. Like if you see, I'm not so great or something, but I went through failures, but I don't want anyone else to follow that because I know what was the pain I felt. So that was my motto, where I'm reaching out to everyone, making sure that you guys don't do what I did, but make sure you reach on the other side before you have the major responsibilities. Like as I said, once you have kids, then the job, it's a huge different cycle. It's not what you are right now today, like all those single people or who have finished your internship and just joined. It's a whole thing. You can totally dedicate. There's no much of responsibility, or there's no much of liabilities coming. But for me, it's like right now it's existence. So that was my major driving factor where I want to get this exam done, because I want to get it done. I have a very restricted time period. Like my son will be joining, he's 3 now, he'll be turning 4 next year. And as sir said,
Mhm.
I am planning to get it done before he is 5, because once his school starts, then it's a different thing. It's a totally
Different thing,
different thing.
yes.
So I have already, my husband was already asked me, what's your plan? And I said, and we three of us had discussed, and we three of us were planning to just start off. We didn't want, in fact, I was telling sir today morning that I don't know with what hope, maybe it's a good positive hope and God's faith, maybe. I already had purchased even the part two books. My mother was like, wait, at least let
And
this
it's
book
a it's a
come.
good motivation, it's like, it's like a treat yourself. And this, I always tell this thing, use that excitement actually, because now you passed, so automatically you will remain very excited for next 2 weeks actually, because sharing your things, and also people will reach you,
Right.
even relatives, friends, juniors of your medical, they will reach you. So that excitement remains, and that comes at, okay, let's do something and things. So this is a very crucial time, where many people utilize it nicely, but some people get confused after some time. And so rather than getting confused, it's always better to start, every day read a case.
Yes.
So in MC2, the theme is every day read one case. Actually, there is like a just maximum 250 cases, to be
Mhm.
honest, actually. So either you read from handbook and the thing, but be aware that in handbook, the cases are not exactly as it comes in exam. Okay, so be aware
Mhm.
of that one actually, because those are written in more details, as like, bit like
Yeah,
John
yeah.
Murtagh, like, it always doesn't come in that way, actually, to be
Exactly.
honest. So it's usually better, like, if you see preformed ones like Marwan, maybe can be a good idea, but lot of mistakes there. Yeah, so better you see any institutional notes. You can see our notes, like SMA notes in that case,
Sure, sure.
and relevant videos. I mean, so, for the mom with kids, we also give, some, you know, benefit in that way, like, if you are not joining, maybe joining later, sir, I have some family responsibilities and things, which it's because it's been like 8 9 months, people like a lot of things to answer to family. So in that case, some people do what, because I'm after the good candidates always, that no, 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 you have to study, I keep telling whenever someone was, no, no, keep studying, keep studying, that motivates in, like, active or passive way.
Yes.
But if I don't tell, they might not study that much actually. So even in MC2 is the same thing for you, or also those of your friend past. And because you are being a class monitor, more engaged with people, just spread that thing that, let's keep studying. At least if you're not studying full, as like you are doing in MC1, at
Yeah.
least every day one case. That will take like a 1 hour. Trust me,
Yes.
like one an hour or 1.5 hour. That you can, even if you again rejoin your job, or some family responsibility. Some people, even one doctor I remember told, doctor, I have to take a break, and I got a little angry. Hey, you're taking break now. You're a good student. Doctor, few responsibilities we cannot deny. Me and my husband has been trying for a kid actually, so now it's time. Okay, let's not get there. And okay, like, but make sure study a case per day, so like, okay, sir, I'll do that actually. So that's how the thing should be. Even if you're taking a break, that doesn't mean you take from the everything from the whole study, because that you will out of the tempo, like, now you are in a flow, you remember everything very well. Now, if you take it like especially, but it is very much common in MC journey. Let me tell you, many take too much time unnecessarily, and they start forgetting the MC1 knowledge and the flow and other things actually. So please, everyone, whoever listening, make sure when you finish MC1, uh, you make a plan in that way that every day one cases, it has to be done actually. It can be from mixing of handbook or marwan, or if you uh, pre-book us, that like in that way, that I will take away the notes now and videos, and later I'll join for live. That options are available. In that case, you can just follow that note and video, and every day one case, and it will take like 1 hour, 1.5 hour. But you think, even if you're starting from 3 months or 5 months, later than this, but by that time, how many cases you are finishing. So it's like a almost 100 case you are finishing, or 120 case you are finishing before again joining the live. So you'll be in more driving seat before coming for role play or any other thing, if even if you are taking some break. So this is another tip to those are actually the just finish MC1. Don't make this mistake and the things. Some people take too much time for that English test. There's a video of mine, if you all can see that what to do after MC1, very precise video. I recommend PT more over the OAT because I felt it's more easier. OET has become more difficult in recent time. In last 2 year, OET has become a lot of failing. We noticed in OET. So, but PT is still been, I mean, more easier actually. But if you're confident enough, like you can say go for a IELTS exam. Even some of you might be from English medium background, has good hold. Then why to invest more money on OET and things? You can just straight away give IELTS. Actually, that's also possible and done actually. So good luck to Dr. Joshna. I'll talk to you. So good luck, and let me take them to the class, and bye for now. And bye for you actually, but for now. But we'll see you soon actually. Into MC2.
Sure, sure, sir. Sure, sir. Sure, sir.
Yes. Good luck, and take care. Actually, God bless you.
Thank you, sir. Thank you, sir. All
Thank.
right.
Good.